Mari, please come on up.
Good afternoon, Madam Mayor, Mr. Vice Mayor, and council members. Happy to provide a brief update on the outreach and cleanup effort that we did today at Santa Rita Park. The cleanup began this morning and will continue till 10 a.m. on Friday when the park will be reopened. The cleanup was required to preserve public health, safety, and welfare, as noted by many departments, parks, TPD, and our outreach teams. Additional outreach to the community members in the park began earlier this month with a significant outreach that was conducted within the last 2 weeks. Many thanks to the Pima County Health Department's mobile unit that had been out with us several times. Outreach teams continued to be on site this morning to ensure that any unhoused community members who wish to access available shelter and housing were able to do so. Some of the partners included the City of Tucson Housing First, Community Bridges, Kodak, La Frontera, Hope Inc., Sullivan Jackson, Community Workforce Development, the VA, CMS, Community Medical Services, American Rehab Campus, which we call the ARC, Old Pueblo Community Services, and our multidisciplinary outreach team, which had several nurse practitioners. 78 individuals were contacted by the outreach team on September 20th. Prior to that, the previous Friday, we had contacted 40 individuals. More than 50 individuals were at the park this morning. Not all were unhoused. We had about 15 people advising us that they had housing opportunities, but were hanging out with individuals that were encamped in the park. None of the individuals that were contacted last week or today accepted any shelter options. They did take the Narcan and the fentanyl test strips, but no shelter options were accepted. We did have 4 initially decide to go, but as it was time to get them in the car, they refused services. We did have low barrier shelter options, as well as other options that may have had some higher restrictions. And again, those were not taken. Emergency medical aid was provided by TFD to one individual that was found intoxicated on the premises and was exhibiting symptoms which others felt like needed to be treated by medical teams, and he was responsive when they got there. No arrests were made during the outreach. However, there were some TV stations and social media representatives filming the cleanup and a small protest activity along 22nd. There were significant hazards found at the park, which were abated during cleanup, including an unusual number of needles indicating polydrug use, one deceased dog, quite a bit of rotting food, and other hazards that we encountered. All 3 areas we originally were going to see if we could just do a section of the park. The entire park did need to be closed down. City workers did collect property, including tents, bicycles, and walkers to return to their owners if they come and pick it up. They are all collected and tagged, as well as marked for people to go pick up at Thomas Price Center, which is where we're holding items for 30 days. Let's see. The park cleanup work, as it's closed, will include major cleanup of park areas, walkways, restrooms, dugouts, and identified needs like removal of graffiti, painting of damaged surfaces and park amenities, as well as repair to damaged fencing, turf areas, irrigation, restrooms, etc. Let's see. The outreach and cleanup effort was collaborated by and coordinated by myself, the multi-agency resource coordinator, but collaborated again between HCD, our community partners, TPD, TFD, parks, and environmental and general services. Overall, it was an efficient operation since all of the resources between city, county, and community agencies were present, and happy to answer any other questions that you may have.
Any questions, comments, my council colleagues? Councilmember Fimbres, and then Councilmember.
What services? How? What services?
So we had both detox services available and housing shelter services. CMS was actually offering Suboxone treatment in the field. And then we had medical services provided by the El Rio nurse practitioners.
Requested them, right? Nobody requested the services?
Nobody took services today.
Councilmember, thank you, Councilmember Fuentes. Councilmember Ulick?
Thank you, and thanks to all colleagues here who've offered us some great updates and information. I appreciate addressing both issues in terms of the unsheltered folks in our community. The fentanyl and opioid crisis, I agree with you, Mayor. It seems like in the last 8 months, I'm very happy to hear we're seeing fewer overdose deaths. It does seem like the walking wounded amongst us and the suffering and the use is really intense. And in looking through stats from different teams and sources, I do want to make sure that we don't conflate the two issues. I know that there are a significant number of unsheltered folks using drugs, but even in some of these more recent engagement efforts, it looks like a third to sometimes a half of folks who are very out in public at the bus stops, in the parks, et cetera, using are not unsheltered. And so I'm very, very anxious and excited to see this collaboration come together to intensify our efforts. Super excited to hear about the mobile unit. Because I believe that many of us want to know what to do when we see somebody slumped over in a bus stop, clearly inebriated in 110 degrees. Who do we call? And who's going to go engage with that person? I think our community needs tools to help. I also did want to ask whether, I worked with Arizona Complete Health for a number of years. They're our regional behavioral health authority. And as I engaged with them, they mentioned the CRC and CBI and other resources that ought to come into play, even assisting our officers so they're not tied up trying to get somebody into treatment and having to wait for hours. Are they at the table with us, and could we invite them to the table to make sure that the Medicaid system and the REBA are really brought in as partners?
Mayor and Council, these are great points. Arizona Complete Health, the Crisis Response Center, they are at the table. They're not the appropriate choice for everyone. And so I think what you are highlighting is this need for a really sewn well together patchwork quilt that takes everyone where they are and responds to what their need is. It is definitely true that the walking wounded, the individuals that are using who are not unhoused are a critical component of what we are seeing. And I think Brandy's report kind of showed that there were people that were just at the park, that they weren't unhoused. So that number is a striking number. As we move forward, we have had engagement with state Medicaid with access because there are some significant changes coming October 1st about housing availability for those who have certain diagnoses. They have to be on Medicaid at the time for them to be able to access up to 6 months of housing if they are unhoused and to access different services. And Lee and Brandy and I have talked recently about some other models we are seeing in other cities, specifically San Francisco, where when people need help, the help comes to them. They're not transported to the crisis response center. There's someone that can go to their home. Now, all of these are labor-intensive, fiscal needs that will have to be addressed. But as we look forward to the decisions to be made around the opioid settlement dollars, I think that there are opportunities there. But what you are pointing out is so critical. because it says we have to meet people where they are. And while I, like you, am very happy that deaths are down, I don't think use is down. And so I don't want us to conflate those two, because it's easy to conflate them. And there's no indication to me that utilization is down. So, thanks.
Councilmember Lee, and then Councilmember Cunningham, Vice Mayor, and then Councilmember Santa Cruz.